الحمد لله رب العالمين، والصلاة والسلام على أشرف المرسلين وعلى آله وصحبه أجمعين. Giardia lamblia by Professor Mahmoud Hani Sulaiman. Definition: Giardiasis will lead to Giardia lamblia is a common cause of sporadic, endemic, and epidemic diarrhea. Sporadic, endemic, and epidemic diarrhea all over the world. Infected persons have acute diarrhea with malaise, cramping, and bloating. Chronic diarrhea with malabsorption or asymptomatic infection. Asymptomatic infection is most common in children, especially in low-income settings, and may contribute to poor nutrition. This is 3 trophozoite of Giardia: A, trichrome stain; B and C, iron hematoxylin stain. Each cell has 2 nuclei, as you see here, 2 nuclei, with a large central karyosome. Cell length is 9 to 21 micron. Trophozoites usually seen in fresh diarrheal stool or in duodenal mucus. This is the cyst of Giardia lamblia. This is the cyst of in stool preparation. Ingested cyst produces trophozoite in proximal small intestine. As trophozoite pass in GIT, they form cyst, then passed in stool and infective form of Giardia intestinalis. This is the typing of Giardia species. We see here those who Giardia lamblia, assemblage A and assemblage B. Those who infect humans, found in primates, dogs, cats, cattle, sheep, deer, rodents. B, assemblage B, primates, dogs, cattle, horses, and beaver. Epidemiology. Giardia is one of most widely distributed enteric parasites. For example, in US, about 17,000 documented infections per year, with infections of more than 1.2 million. It is most frequently in children 1 to 9 years and adults around 50. In poor countries, Giardia in about all children by age of 10 years. Transmission of this fecal-oral parasite is most common through person-to-person transmission, untreated or inadequately treated surface water, occasionally via contaminated food. This is the life cycle of this parasite. This is the beginning. Cysts are transient forms. Transmission will lead to transmission of disease. Cyst trophozoite found in diagnostic stages 1. Diagnostic stages 1. Then cysts survive several months in cold water. Infection occurs by ingestion. This is 1. Ingestion of cysts in contaminated water or food, or by fecal-oral route, hands of mice. This is 2. Ingestion. In the small intestine, excitation releases trophozoite. Each cyst gives 2 trophozoite. This is 3. This is 3. Trophozoites multiply, remaining in lumen of small intestine, then they feed or attach to mucosa. This is 4. Incestation, when parasites transit to colon. Cyst is stage found most commonly in non-diarrheal feces. 5. Cysts are infectious when passed in stool. Person-to-person transmission is possible. Diagnosis: a clinical syndrome of diarrhea and or other GIT symptoms lasting about 10 days and associated with weight loss without fever. weight loss without fever. Distinguish giardiasis from other enteric infections. Epidemiologic risk factors are history of travel to endemic area, drinking untreated surface water, having young children in daycare, or engaging in sexual practices with potential for fecal-oral transmission. A stool exam for ova and parasites is traditional way of diagnosis. Antigen detection is available and more sensitive and specific than stool examination. PCR becoming more. Symptoms of giardiasis, and this is the frequency percentage of them: diarrhea, malaise, flatulence, foul-smelling greasy stools, abdominal cramps, bloating, nausea, anorexia, weight loss, vomiting, fever, urticaria, constipation. Print and use. Therapy. See comment table, it will contain the details. Tinidazole is drug of choice in a single dose. Alternative: metronidazole, nitazoxanide, and albendazole. Potential adverse events associated with treatment must be discussed with patients. You must tell the patient the adverse events. Treatment during pregnancy requires special attention. Post-Giardia, irritable bowel syndrome, lactose intolerance, or another organism or cause should be considered if treatment appears to fail. If parasites are present, then retreatment with a drug of different class is usually successful. This is the details of the doses in adult and pediatric for treatment of giardiasis. Please print and use. Prevention of giardiasis requires proper handling and treatment of water used for communities and good personal hygiene, hand washing after defecation, before eating, and after eating. Although halogenation, chlorine and iodine tablets alone is sufficient to kill lamblia cystis, important variables as water temperature, clarity, pH, and contact time of chlorine alter efficacy of chlorine, and higher chlorine levels, about 6, may be required. So plus chlorination, public water for drinking must be subjected to coagulation, flocculation, sedimentation, and filtration. We will describe this in water sanitation. Continued prevention. Travelers to endemic regions or to wild area must consider all water potentially contaminated due to wide array of animal and human reservoir of giardiasis. Boiling is enough to kill protozoal cyst, but Cryptosporidium is resistant. Many chlorine-based, like chlorine bleach, or iodine-based, like tincture of iodine, preparations in liquid or tablet form are present. Use of any of them. Increase contact time for water and increase concentration of halogen for turbid water. Personal water filters with pores of micron size, 0.2 to 1 micron used. Filtered water must be halogenated to kill enteric viruses if they are a risk. Avoid uncooked foods washed or prepared in contaminated water. Continue prevention. Giardiasis outbreaks in daycare centers are difficult to manage. Some recommend that only symptomatic children be treated, but infected children transmit Giardia to parents and family members, with increased potential spread to community, so each situation requires an individual decision. If strict hand washing and treatment of symptomatic children fail to control outbreak of diarrhea, consideration can be given to treatment of all infected children. Treatment-based strategy of transmission prevention in endemic settings may not succeed. Human milk can be protective against Giardia. Both animal and human breast milk can contain anti-Giardia antibodies. Studies showed protection of breastfeeding infants from symptomatic infection. وفي النهاية لا أجد إلا أن أقول الحمد لله رب العالمين و thank you for your good listening.